I'm Rob Merrill, and I'm pleased to be joined today on Health Beat by nurse practitioner Angie Smutny with Faith Regional Physician Services Family Medicine in Norfolk. And we're talking about allergies. So what are the main causes of allergies and how are they treated?
Well, there's lots of different causes. You'll see the main allergies come out usually in the spring and in the fall, but they can happen any time of the year, any time of your life. The biggest causes usually are dust, pollens, things like that, and it's the time of the year where the farmers are getting out in the field and the dust is getting kicked up.
Yep.
And also the trees and plants are all starting to come out and bloom and pollinate, and it's horrible for anybody that does have allergies. They really don't like this time of the year. They'd much rather it was a time when it's frozen out.
Yeah.
But things that we can do, normally with allergies you'll see a lot of watery eyes, itchy eyes, even some pain in your ears. And even can feel like you're talking in a tin can with the fluid that comes within your ears. Lots of nasal drainage, lots of post-nasal drainage, all of those things that are just pesky and annoying. The biggest thing that we can do is treat them with over-the-counter allergy medicines. Some of those are Zyrtec, Allegra, Claritin, the simple little things like that. If things get worse, then we can look at nasal sprays like Flonase and things like that that are over-the-counter, and also prescription as well. And if it continues to get worse and it just is not controlled, which sometimes it's not, you can always come into one of the clinics and talk about a steroid injection to help with that as well.
Oh, okay.
For people that suffer from serious allergies and that are really bad, the other thing that we do is refer you to an actual allergist to be desensitized from those allergens. And that would include, a shot a week usually to try to get your body to get used to those and not to fight them. There are people that do those. There's not a lot. Most of the people usually are well controlled with, like I said, the over-the-counter allergy medicines, decongestants, the nasal sprays, things like that. So
That generally helps most of us anyway.
for the most part,
Yeah.
yes. Are there some that need the steroid when it gets really bad? Absolutely.
Sure. Okay. Well, that's great information to have. Thank you very much.
You're welcome.
And that's Health Beat, brought to you by Faith Regional Physician Services.